Good afternoon, everyone, and welcome to our webinar, Are You Really Listening? My name is Tregoning. I'm a professional liaison consultant for the Health and Care Professions Council. Our topic today really matters. It matters now more than ever. The work we do in UK healthcare is incredibly demanding. It's complex, it's fast-moving and constantly changing, and delivering great care can sometimes feel like a moving target. Research and countless inquiries tell us the same story. When people feel safe to speak up, and when leaders and teams genuinely listen, we catch issues small and they stay smaller instead of growing into more serious problems. We have one of the safest healthcare systems in the world, but we still have room to improve, which we'll talk about later on in the session. What I'd like to do is start with an exercise, if I may. We're going to be using Slido. You'll either need to navigate to slido.com on a browser or use the QR code that comes up on the screen. And what I'd like you to answer for me, if you can, is what is the most dangerous occupation? So is it commercial fishing? Is it construction, agriculture, the armed forces, or the fire service? It's always a relief to see people jump in straight away. Thanks for whoever put that answer in. So I'll give you just a few moments to get your answers in. There may be a small delay on the answers coming in, so I'll just give a few moments. Here they come now. So commercial fishing has taken an early lead. And then we've got a tie between construction, agriculture, and other. No one thinks the armed forces is unsafe. Depends where you're working, I suppose. Right, well, thank you very much. So we are tied. I'm going to move on and do the big reveal. I don't have a drum roll, I'm afraid. But so we've got a winner there in agriculture. I come from a farming background. My brother's a farmer, and I could regale a few stories from farming incidents. But let's move on to the answer. The answer is actually none of the above. So it's actually any occupations that involve significant amounts of sitting or sedentary behaviour. So it's a bit of a trick question, so I do apologise for that, and I do appreciate your contributions. So why sitting? Well, many of us will know that prolonged sitting or sedentary behaviour is linked to higher risks of heart disease, diabetes, some cancers, and even early death. This is a reminder that sometimes the most obvious dangers, the most visible dangers, are not the things that cause the most harm. And in healthcare, the research shows that the biggest risks, the biggest harms don't usually come from a single dramatic mistake or from bad apples, but from a combination of small issues in a complex system that build up over time. And that is why, as regulators, we talk about speaking up and listening up and trying to achieve a speak up and listening up culture within our healthcare teams and organizations. Because it's only when we share what we see and hear, and it's only when we listen that the system can adapt and learn and keep people safe over time. So today we'll be talking about why raising and listening to concerns is important. We'll cover some of the barriers according to the research and talk about some strategies for overcoming those barriers, and finally land on developing a speak up and listening up culture, how we might do that within our teams. So the Health and Care Professions Council is obviously a healthcare regulator of professionals. And like the other professional regulators, it exists to protect the public and also other health and care professionals or colleagues as well, because unless we protect and care for colleagues, they cannot protect and care for patients effectively. So the HCPC exists to ensure that professionals meet high standards of practice, conduct, and ethics. And one key part of that is creating a culture where concerns about safety, competence or practice can be raised and addressed appropriately. So listening to raised concerns aligns directly with our purpose as a regulator because it helps to prevent harm, it supports professional accountability, and ensures that both patients and professionals are working in a safe and trusted environment. So many of you will be familiar with some of the inquiries on the screen. This is over a quarter of a century's worth of inquiries into healthcare incidents. And in the NHS, as in many sectors, there are plenty of examples where systems, individuals, organizations were not as open as they could be about where things were going wrong, and as a result, harm was caused. So we have approximately 56 million pounds worth spent on these reports on the screen, over 2 decades of inquiry time, and over 2.6 million words. And there were many lessons, many unique to the context in which the events occurred, but also many commonalities around the importance of openness, having a speak up culture, but also crucially a listen up culture as well. So these are some excerpts from the Francis report on the mid-staffs inquiry, which I'll give you a few moments to read through. So we're over 10 years on from the public inquiry into Mid Staffordshire NHS Foundation Trust, which looked at serious failings in care between 2005 and 2009. These failings in care resulted in hundreds of unnecessary deaths and suffering for patients. Despite numerous warning signs from patients, families, and some staff members, concerns were not adequately addressed or escalated to the appropriate authorities. And so the subsequent reports highlighted basic failings in care, as you can see upon the screen. So why is raising and listening to concerns important? Well, it's because the healthcare system is safe, but it's not as safe as it could be. Now, there's important caveats with looking at avoidable mortality data. It's all in how it's measured, and there are different measures and there are also different definitions. What you can see on the screen are the estimates provided by the Office for National Statistics for 2023. It estimated that 22% of deaths in 2023 were avoidable. So that's 126,000, and 36% of those it considered treatable, which means those deaths were potentially linked to suboptimal healthcare. So this is for in and out hospital mortality. You can also see on the screen another study, the PRISM study from 2012, which was a retrospective study looking at mortality in acute hospital. And they found that around 5% of hospital deaths, or 11,000 a year approximately in England, may be preventable due to care issues. And as I've already said, most avoidable deaths don't happen because of a simple mistake or through bad apples, but through system problems and communication breakdowns and ignoring warning signs. And what you see on the screen is an estimate of the harm that could be caused by missing those warning signs. And sometimes it's hard to get the figures into our heads. So what is 36% in something tangible? Well, it's around 108 Boeing 747s, or it's filling the Principality Stadium here in Wales, in Cardiff, to 60% capacity. And a question I would ask is, if the Civil Aviation Authority lost 108 aircraft in a single year, what would they do? I suspect that the response would be immediate, coordinated, and systemic. And of course, there are limitations to comparisons between sectors, between aviation and healthcare, but the scale does help remind us of the urgency and the responsibility we share as leaders in the healthcare space. Another reason why raising and listening to concerns is important is the standards mandate that we should do so. So Standard 7 says we should raise and act on concerns where we think that patient safety, dignity, and care may be compromised. We should also follow up on concerns that we report, and leaders or managers must act on concerns reported to them. And this obviously demonstrates a commitment to transparency, accountability, and continually improving the services that we offer. So what are some of the barriers to raising and listening to concerns? So what you see on the screen is a summary of some of the research around the barriers to speaking up. And I've organized these in individual and human and organization and system. So on the individual and human side, it could be a fear and a lack of confidence of speaking up. And it's important to say that sometimes that fear is as a result of legacy factors. It's not always due to how it feels to work in your team. And there's a complex set of factors which add up to our confidence to speak up in a given situation, which could be due to primary socialization, how we were raised, schooling, our peer groups, and all sorts of other factors. But certainly a significant factor in whether people will speak up or not. There are cognitive biases, for example, futility. Someone may have seen speaking up in the past, may have seen limited impact of it, or even punitive actions off the back of it, and feel that no good will come of the speaking up in the first place. They may not know how to speak up, especially if it's an interpersonal situation. They may feel awkward. They may feel what they're saying is rude or not acceptable, and just not have the communication skills for it. They may also think it's somebody else's job, or even have compassion fatigue. So they may not have the energy or the care to speak up and to try and improve things. So from an organization and system point of view, we all have a hierarchy in the places where we work, but if it works in such a way that it makes people feel they can't speak up to people in positions of authority, then people will not speak up, and that will lead to reduction in information flowing freely through the system. And of course, the busier the system, the more resource pressure. If there's a culture of fear and blame, if there are disciplinary processes which punish simple mistakes, if there's normalization of deviance so people don't know what wrong looks like or what right looks like, or if there's a lack of training and organizational support for the raising of concerns. And what about the enablers? Well, these are often the flip side of the barriers. So some people just have a lot of self-confidence. They're very assertive. If people have a strong ethical or moral conviction, or they have a strong group around them that encourage and support them to speak up, or even a group speaks up, and that can be quite helpful. Some people have high levels of interpersonal competence. They're willing to take risks interpersonally to ensure that the right things are said, and they may have had a previous positive experience of speaking up and a change happening. On the organization and system side, strong leadership and role modeling, particularly role modeling vulnerability. So if leaders, for example, talk in staff meetings about mistakes that they've made, if there's a good supervision system in place where more experienced members of staff talk about mistakes they've made and how they learned from them, if there are clear speaking up and reporting mechanisms, including anonymous reporting mechanisms such as a speak up guardian, high levels of psychological safety, cultural competence training, so just teaching people how to speak up, giving them techniques or tools to do so, and seeing a previous constructive response to feedback. So that's enough for me for a bit. I'm just going to ask you now, what do you think are the main barriers to managers and leaders speaking up where you are or in places where you've worked previously? You can submit as many answers as you like for this, by the way, and the size of the word relates to how often it was submitted. Right, so thank you very much for all who have submitted, and do keep putting your answers in. So you can see clearly fear is a clear winner there, and that is not actually unusual. When I ask this question, which I do to many different groups, from the board, down to frontline staff, fear is often reason number one. And as I said, it's not limited to people being on the front line or more junior in organizations either. So poor leadership. So certainly if the leadership doesn't model openness and vulnerability, doesn't encourage speaking up, or responds negatively to speaking up, then those could be things that would certainly inhibit speaking up. And bullying and harassment and discrimination, all of these things are likely to stop speaking up, particularly from affected groups as well. And there's many other issues on the screen which would suppress speak up and openness in a culture. So yeah, managers not being visible. If you don't know who to speak to, or if you can't get time with them, then you're less likely to speak up. We know that it's very hard to make soft intel turn into hard intel. So with some concerns, as soon as you ask somebody to write it down, put an instant form in, or to go through a formal channel, that concern is likely to disappear rather than become formal. So it's really important to be visible as a leader or a manager, to have regular conversations with your staff in non-pressured situations, if possible, to allow them to speak up, raise concerns, or even just have ideas for service improvement, for example. Yeah, too many issues, intense workload. If you're so busy, you're just trying to survive, just trying to get through your shift or your working day, then that is going to put significant barriers in the way of even thinking about the need to speak up and speak out. Not being believed, yeah, lack of confidence, significant power imbalances, biases from the leadership, dismissive attitudes, a lack of clarity or accountability, not knowing whose responsibility it is. So many problems that you see in healthcare may not be your direct responsibility. Knowing who to talk to can be a significant challenge. That's brilliant. Thank you very much for sharing that. That's really helpful. So what does the research say the potential barriers and enablers to listening up are? So this was mentioned on the Slido. So biases, some examples of those: confirmation bias, availability bias, and normalcy bias, which I'll talk about in a moment. Person's leadership style, if it's autocratic, sometimes we need command and control in emergency situations, but it doesn't suit to most other situations. Leaders should be vulnerable, approachable. They should engender high levels of psychological safety, or people taking interpersonal risks within a team, of which feedback is one interpersonal risk. Having healthy power dynamics and not significant power differentials, and a more flattened structure, we know can promote feedback. And having leaders and managers that are available and accessible to you, and accounting for the risks appropriately, which I'll talk about in a moment. So what makes us more likely to speak up? So if we notice when things are going wrong, if we're agile and we're able to adapt ourselves, and we're able to see where improvements need to be made, if we work in a team where the leader has a humble and curious leadership style, And we're also curious, and we also see ourselves as a leader. So the regulator believes in collective leadership, so we should all lead from where we are, whether we're in a formal position of leadership or not. And that's crucial to encouraging speaking up within our team. And having that open mindset to being open to learning from mistakes, whether they're ours or other people's, is also really helpful to get people to speak, but also for us to be able to listen and not feel defensive as a manager or a leader. And if we in turn as a leader or a manager have high levels of psychological safety, if we work in a space where we feel supported by those above us and encouraged to learn and grow from our mistakes or when things don't go so well, then we're much more likely to be able to listen up effectively and make changes that we need to make. So what types of bias can prevent listening? So we've talked about confirmation, normalcy, and temporal discounting. So confirmation bias is a tendency to notice or give weight to information that confirms what we already believe. This obviously affects humans generally in life. But what this leads to is us ignoring information that's counter to the story that we already believe. We ignore data, we ignore feedback that is contradictory to how we feel the situation is. Normalcy bias is when we assume things are normal and we ignore potential warnings or unusual signals of an adverse event or safety incidents. And temporal discounting is where we give greater attention or weight to the immediate risks of harm, and often that's an interpersonal risk that we overestimate the risk from without paying sufficient attention to future risks of harm to us, our reputation, to patients, and to the organisation. And availability bias is a key one. It's a logical error where people base their judgments on information that's most easily available. It's a type of shortcut, if you like, and can be helpful, but in the context in which we're talking about, it may lead to a cursory approach to investigating incidents or to safety or to when things go wrong. What it may mean is that we only see problems and solutions that are visible. So we receive feedback from those who speak up, hard intelligence from, for example, pulse surveys or annual surveys, DATIX and incident forms, but often ignore missing voices or information and don't look hard enough to get that information so that we can make better decisions. There's a really good example of this from World War II, where Allied aircraft were flying missions over Europe and sometimes losing over 50% of the aircraft on those missions, and the losses were unsustainable. The engineers wanted to reinforce the bombers in the right places, and so they kept meticulous records of patterns of damage on the returning planes with the intent to increase the armor in those places. Abraham Wald was an engineer, and he realized that the useful information about the vulnerabilities of a plane to attack from the air, from other aircraft, from flak, for example, and from the ground, was actually on the planes that had ended up in the wood, in the field, in enemy territory, or in the sea, and wasn't in the planes that came back. So if they'd made those changes, they would have just made the aircraft heavier, more unwieldy, and would have made no difference to losses of aircraft or air crews. So in healthcare, missing voices are like the unseen planes. The planes represent concerns that aren't raised, where people are silenced or ignored, and it's the information that we haven't received, which often leads to a bit of a dumb approach to finding solutions to problems. So if we're learning organizations, we should regularly ask who didn't speak up in that conversation, what other system pressures contributed, and what information is missing from this picture. So to prevent harm and improve safety, we as leaders must listen up and actively seek the concerns and the information that isn't immediately visible. So how can we begin to overcome the barriers? Well, there are many different ways, and that will depend on your setting, what will be most appropriate, and you will know what the barriers are in your team and in your organization, and therefore what's likely to be most effective in overcoming them. We generally recommend that you make a process for speaking up really clear to your employees, having a policy, but not just a policy, just making everyone aware of what the expectations are. And we generally recommend a stepwise approach. So asking, can you put the matter right yourself? Can it be raised within the team or department or organization? Is there a speak up guardian, whistleblowing advocate, or a speak up champion of some sort? And can you resolve that issue locally? And if you can't resolve it locally, then seeking independent advice and support, and as appropriate, speaking to the relevant regulatory body, whether that's a professional regulator like the HCPC, regulate 15 different professions, or a system regulator like the CQC or Healthcare Inspectorate Wales here in Wales. So another method is improving interpersonal competency. So many of you may have heard of the coffee cup conversation approach. It's an attempt to get over staff's lack of confidence in raising issues about behaviours, attitudes, or working practices as they arise. So if issues aren't addressed when they're small, they can persist, they can grow, and they can also lead to follower type behaviour, which ultimately undermines your culture and undermines safety for colleagues and patients. So a coffee cup conversation is one way, and there are many different methods of showing staff how to have constructive conversations when problems are small. So these wouldn't be appropriate for significant problems, for severe problems, or where patient safety or staff safety is at risk, but more for what they call less egregious situations. So a coffee cup conversation is a single story about someone's behaviour or performance. It's a type of heads up to reflect on the behaviour and performance. It's recommended that it's done in a neutral or private location and at appropriate time, but ensuring that timing is as near to the event as possible. It's a hallmark of professionalism. If we keep quiet, sometimes that can mean agreement, and behaviours and poor performance can certainly escalate over time. It's recommended we do it in a non-biased, non-judgmental way. If appropriate, we prepare, try to stay calm, and keep the messaging simple and keep it brief as well. So this is an example of how this has been applied in practice as part of a sort of broader disciplinary process. So it's part of a tiered approach to addressing behaviours of poor performance, and it promotes accountability from the beginning after that single event, but also carefully defines the next steps. So it's not appropriate to keep having coffee cup conversations for one individual committing the same behaviour. Some escalation may be required over time. What you can see on the diagram is that some behaviours, competence issues are seen as egregious or serious, and they would have mandated reviews. And obviously, where the regulator is concerned, some things which are harmful to patients or are so significant that they need to come directly to the regulator through your normal processes, and you should have a process in how to do that. We can also give people tools or techniques so that the whole team is familiar with how to give feedback, whether it's constructive or challenging, and how to receive feedback as well. So the situation behaviour impact tool is just one of those So the idea is that you describe the specific context in which the behavior or the competency issue occurred. You describe the behavior precisely, so you focus on what you saw, not any assumptions or your interpretation of it, and then you explain the impact of the behavior on you, the team, or the patient, for example. So this can be used in a constructive way. For example, during yesterday's team meeting, you raised concerns about the project deadline, and this helped clarify priorities for everyone and fostered open dialogue. But it could also be used to give constructive feedback about performance or conduct, such as inappropriate banter, for example. So I have a problem-based scenario now around a multidisciplinary meeting. I want you to imagine a scenario where a multidisciplinary team is meeting to discuss patient care and operational updates. The context is that the team is feeling overstretched, they are understaffed, and there are some processes which are failing staff and patients. So the meeting is led by a senior consultant and another member of staff who have a tendency to dominate the conversation, talking at length, interrupting, dismissing alternative viewpoints, and they don't notice that no one else is speaking. So this is causing other team members, including junior doctors, nurses, allied health professionals, to be visibly uncomfortable and unable to speak up. So the question is, what are the key issues with the meeting being run in this way? So if I could get you to jump on Slido again and give me your answer to that. So what do you think are the main issues with the meeting being run in this way? Yeah, fairness is clearly an issue here. So not everyone's having their fair go at having their say about raising the issues, whether that's about patients being discussed or processes or giving feedback. Yeah, crucial. Key information is missing. Everyone who's silent has information that's useful to increase the learning for the team. It's not at all collaborative. It's too hierarchical. Yeah, so we've got a leader-follower model, a command and control type model, rather than leader-leader model, which we know can tend to suppress information. Unilateral opinions, yeah, it's going to lead to disengagement for sure. So those people, if they're human, who aren't getting a say, if that happens for long enough, are going to disengage, and the result of disengagement is likely to be more safety issues. Needs a proper chair, I completely agree. Needs a chair who knows what they're doing. It's not inclusive, no, that's correct. And make people anxious to speak up. Absolutely. I'm going to move on in about 10 seconds for the 3 who are still typing. I'm not sure what hippo is. You might have to put that in the chat for me. Perhaps I should know, but I don't. Yeah, it's dominant and not non-collaborative. Lack of effective social and interpersonal skills. Yeah, so not noticing the discomfort, not noticing people are becoming disengaged, not noticing people aren't speaking, shows a distinct lack of interpersonal skill, perhaps, or it's intentional. But I'm going to have to move on, but thanks so much for your answers. Hired paid person's opinion, no comment on that one. So how could we do this better? And I'm sure you will all have some great ideas. Some of them are kind of already suggested by the answers that you put in place. So one way suggested from the literature, particularly around psychological safety, is that we frame meetings in the right way. So when you're talking about challenging topics, acknowledge the complexity in what you're trying to do, acknowledge the complexity in giving great care and how many spinning plates there are going on, and encourage participation regularly. So not just at the start, but throughout the meeting. And particularly encourage half-formed ideas when you're thinking about problem solving and coming up with solutions for the future. So when we don't do that, people think they have to have a fully formed idea And often that means that you miss key information during those meetings. So ask people to input. So if people are quiet, especially if you know they normally speak, then ask them, what do they have to say on the matter? And if people are less confident to speak in meetings and it's relevant to get everyone's opinion, then perhaps you can find another way to consult with them and to get their view and to get their feedback. So setting rules for equal participation in some meetings can be appropriate. Encourage turn taking and active listening, such as by using a round robin or even having a rotating chair. That can sometimes help to distribute power evenly through a group. Demonstrate the values that you want to see. So talk about, be vulnerable, talk about mistakes that you've made and learned from. Acknowledge different viewpoints, even if you disagree with them. And also sometimes there's a place for challenging dominant voices. So if certain people always speak up, and particularly if they speak over others, finding a sensitive way to challenge that, perhaps giving them feedback afterwards, to try and help improve that dynamic for them, but also for the other people in the group. So how do we encourage speaking and listening up generally? Well, what's recommended is that we try to flatten unhealthy hierarchies. So we're not suggesting that we have no governance structure and no people in senior positions, but it's when the impact of that is suppressing feedback, then that becomes a problem. So there are some ways you can get around that, such as reverse mentoring, being highly visible, having walkarounds, having project groups where you pull in people of different experience and disciplines and seniority, acknowledging complexity and understanding vulnerability, and empowering people who are not speaking up. And then think about cultural intelligence in your team. So is there any training that you can provide to help staff to speak up, to challenge disruptive behaviors when they're small, and to challenge unprofessionalism? And is there any training that you can provide to encourage your team to lead from where they are, to kind of embrace that collective leadership model? And HCPC has a professionalism into practice program, and we do teaching on all these things. So challenging professionalism, leading from where you are. So if that's something that would be helpful, please do reach out to us. And then think about your policies and processes. So are your reporting procedures sufficient enough to allow people to speak up? What if they want to speak anonymously? How do you do your investigations, whether they're informal or formal? Are you asking who is to blame, or are you asking what happened? And what's it like to work in your organization? How easy is it to own up to a mistake? Do you have clear guidance on professional boundaries, civility and respect? Do you have a kind of co-produced civility and respect charter, for example, where people know what's expected and are therefore able to hold each other account to that? So how do we go about developing a speaking up and listening up culture? Well, this is my summary, but as I said earlier, you will have your own ideas. You know your context better than anybody, what the challenges are, what the barriers are. But these are just some suggestions from me based on my experience and the research, and also working with people doing great things. So what I would recommend is that you invest in your speak up culture as much as you do in your strategy and processes. What we have a tendency to do is focus on how we work, but the research shows that how we feel and how we relate to one another is equally as important as how we work, as a focus on a strategy or mandatory training or processes, for example. So it matters how it feels to work in our teams and how people relate to one another. So we have to focus on that, and our training program and our efforts to develop our staff should reflect that relative importance of that. So we need to make speaking and listening up business as usual. So it shouldn't get to the point where someone's raising a concern before they are giving a heads up on a pattern of behaviour, a problem with the process or performance that they've noticed. And we should also be better at identifying who is and isn't speaking up and what the barriers are and stopping people speaking, having ideas, giving feedback. Are there ways we can actively cultivate openness? Can we have a feedback box, anonymous reporting channels or forms? Are there ways we can increase psychological safety in our teams and reduce our own bias, for example? Are there ways that we can engage with groups that we haven't formally engaged with, or people that perhaps we haven't always seen eye to eye with, to try and understand their viewpoint better? And there are other ways we can increase interpersonal competence and try and reduce that unhealthy hierarchy. So can we do training on intervention models, just simple tools, so that the whole team is aware that this approach is encouraged, whether they are giving feedback or receiving feedback? And remember the value of soft intelligence. So sometimes you'll hear a conversation or someone will tell you something in private. We can't rely solely on hard intelligence such as surveys and formal channels, because lots of information is lost in the interface between soft and hard intelligence. So sometimes we have to get better at having those informal chats with a wide panel of people, so that we can learn from them and then act accordingly before it becomes so big that it becomes an incident form or a whistleblowing event, for example. So that's my summary, but as I said, that's just kind of some of my thoughts from my experience and from working with healthcare teams and also from the research. But you will have other ideas, and I'd encourage you in the next week or so, if you found anything helpful, if it sparked one thought in you, or perhaps one action that you might take, that you sort of reflect on that and write that down. And if anything good comes from attending this session, we'd love to hear from you. And they say you forget 90% of what you've learned within 7 days. So if you take 10% away, I'm glad. And perhaps it's just to encourage you in the good work that you are already doing. But thanks very much for attending today. That brings us to the end of the formal bit of the session. The last thing to say is that I do have a feedback form which you can access through the QR on the screen. Would really love to hear your thoughts and your feedback on the session generally. Thank you very much.